Today's video topic is peppermint oil. Peppermint oil is usually extracted from the leaves of the peppermint plant. It has a sharp odor but a cool and refreshing taste, and it is used for a variety of purposes. Its main chemical components are menthone and menthol. Uses: peppermint can be used as a remedy for some medical conditions like nausea, irritable bowel syndrome, and other digestive issues. A flavoring agent in foods and in products like mouthwashes. A relief from itching, headaches, and muscle pain. A pleasing scent added to soaps and cosmetic products. Ways to use peppermint oil: it can be applied directly on the skin, ingested orally in the form of a tablet or capsule, diffused in the form of essential oil, or applied intranasally. You should check with your doctor before you consume peppermint oil in any form. Benefits: most of the potential benefits of peppermint oil are based on personal testimony. However, research is ongoing into the health benefits. Let us explore some of that research. 1. For IBS. Most extensive research into the benefits of peppermint oil has focused on IBS, which is a chronic gastrointestinal condition. It involves diarrhea, abdominal pain, and constipation. Researchers have found that treatment with peppermint oil helped to improve abdominal pain and other symptoms of IBS. It does this by having an anti-inflammatory effect and reducing pain sensation in the GI tract. 2. For other GI conditions, menthol, which is one of the main chemical components of peppermint oil, has been used in combination with caraway to treat symptoms of functional dyspepsia. Dyspepsia is characterized by indigestion, bloating, and pain in the stomach. This combination treatment helps in relieving symptoms associated with functional dyspepsia. 3. For nausea. Nausea has many causes, and it occurs occasionally after an operation. Symptoms like nausea and vomiting are also common in the early stages of pregnancy. A study in 2016 assessed the effect of inhaled peppermint oil on postoperative nausea, and it revealed that patients claimed that the level of nausea reduced after inhaling peppermint oil. Researchers also considered the effect of peppermint oil on nausea in patients with cancer who are receiving chemotherapy treatment. They found that it lessened the frequency and the severity of nausea and vomiting. 4. For pain. Menthol and wintergreen oil have been used as a remedy for pain from tension headaches and migraine. In tablet form, it also helps to relieve discomfort in people with trouble swallowing. Possible drug interactions with peppermint oil. Before taking any supplement products, it is important to consult your doctor or pharmacist, especially if you're currently taking another medication. Peppermint oil may affect the rate at which the body breaks down cyclosporine. Cyclosporine is a drug that is usually given during an organ transplant process to prevent the body from rejecting the new organ. If peppermint oil is used with this drug, it causes the drug to stay longer in the bloodstream. Other medications that peppermint might interact with include simvastatin, lovastatin, and ketoconazole. You should also be cautious if you're taking drugs to reduce stomach acid like antacids, H2 blockers like famotidine, and proton pump inhibitors like omeprazole. Who shouldn't use peppermint oil? People with G6PD deficiency. Peppermint aromatherapy can also be toxic to your dogs and cats.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.